Hi everyone, this is Dr. Jeya Suriya, MD General Medicine. I am working as an internal medicine consultant in Apollo hospitals at Madurai. Right. So today we will be speaking about GERD. What is GERD? It is a gastroesophageal reflux disease. Okay, this is the most common problem which is encountered from all age group, starting from the age of even kids, or else most predominantly occurs in the teenage group, from there to the elderly. Why this problem is present universally? Why everyone is suffering from GERD? This is purely occur because of our lifestyle. I'll start up with the causes, what is causing GERD, then I'll go step by step how it is explained to you, so that later I'll try to give few points to avoid GERD. So the most common causes for GERD, number one, is our timing of our food. Most often we try to skip over the breakfast. This is most commonly seen in the age group of teenagers. Okay, they try to skip their breakfast while going to school or going to college and any work, they try to skip the breakfast. So don't ever avoid your breakfast. That is the first step for the GERD. Second, improper timing of your food. What happens is we skip our breakfast, we go directly to our lunch at a time of 2 or 3, or sometimes we even delay up to 4. So this causes an important factor for the GERD. Similarly, if you go on with the dinner timing, most people have their dinner timing at 9 o'clock, 10 o'clock, and some even go stretch up to 12 o'clock. This is not the timing to eat your food. So I'll tell you the timing which is better so that you can avoid GERD. First, you have to try to have your breakfast at 8:30, preferably close it before 9, and your lunch should be preferably from 12:30 to 1:30. If possible, you can close your dinner before 6:30. Or else try to close your dinner before 7:30. No food after 7:30, because before going to sleep, 2 hours before sleep, your stomach should be empty, or you should finish your dinner before 2 hours going to the sleep. So the timing ideally comes around now is 8:30 in the morning and 12:30 in the lunch, and dinner will be around 6:30, preferably closing before 7:30. If you follow this step itself, you will avoid GERD. And number 3 is that you have to avoid all spicy food items, especially at night, and you have to stop smoking as well as alcohol consumption. The smoking and alcohol are the major cause for GERD. So try to avoid those two also. And similarly, avoiding the aerated food items like Coca-Cola, Pepsi, which always aggravate the GERD. Most people believe that if we have any spicy food or non-veg, then we have to take Coca-Cola that helps in digestion. It is not so. It is going to make the situation much more worsen. So try to avoid taking those Coca-Cola, Pepsi or any aerated food items. Similarly, if you are planning for a heavy meal, if you are planning for a biryani, then try to take warm water before going for the lunch. So that helps you in more digestion and that avoids the GERD. So these are the minor steps regarding the food which you have to avoid, and regarding the food that you have to completely stop is the aerated food items, spicy food items, even coffee, tea can aggravate the GERD. So any people taking coffee daily morning in empty stomach is most common habit that again aggravates GERD. If you want to take coffee, have some mild breakfast like biscuits or bread, then take a coffee. Don't take the coffee and tea in empty stomach. Try to avoid those. So that also reduces the GERD. So GERD symptoms, they usually present as a chest pain. Most of the people get panic that once we get into any chest pain that it is going to be a heart problem. No. Most commonly the GERD presents you with a heart pain only, that is chest pain only. In that time you have to visit the doctor only. The doctor can examine, he can analyze, he has to do an ECG before telling it to be a cardiac or it to be a gastric complaint. So don't get into a panic mode whenever you get into a chest pain. Okay. So if at all you are getting any chest pain, try to visit any nearby doctor, try to do an ECG so that can be solved, whether we can classify it as a gastric GERD or it can be a cardiac pain. Then few words about the treatment of GERD is, again we have plenty of drugs available that depending upon the client we will be deciding it. So again it has to be taken the call by the doctor only. Never take any medication from a pharmacy. Try to visit the nearby doctor. He will examine, he will choose the right medication for you. So the take home message for GERD, plan your food on timing, avoid spicy food items, avoid coffee, tea in empty stomach, stop smoking and drinking. Thank you.